Well, my guest today is Dr. Todd Brookover with Urologic Specialists of Oklahoma. Welcome, my friend.
Thank you.
Good to see
Good to
you.
be here. Yeah.
You're a busy guy. hard to catch you. We've got you here because we want to establish this journey I'm on, let the fellows at home know what possibly faces some of them. And I wanted to establish the fact that you are my urologist. We're opening our records here, or my record. You're free to talk about it.
Okay.
When I came to see you, there had already been a red flag raised because I went in for a physical, they did a blood test. What caused them to send me to you?
Well, in your case, you had a screening PSA. Your original PSA came back at almost 19, which is markedly elevated. Upper normal in our labs, 2.5. So they referred you to me for that, and you were having some symptoms that were consistent with prostatitis. You were having some frequent urination and some decrease in stream. We gave you antibiotics. A month later, your PSA was 11, which was a nice improvement, but your symptoms had improved, but you were still having some irritation. We repeated a course of antibiotics, and again a month later, your PSA was right at 11. It really didn't change from that point. And we waited another month and rechecked it, no change. And so at that juncture, we decided to take a look with a transrectal ultrasound and do some biopsies.
Which you did.
We did. During that procedure, on ultrasound, there was nothing obvious as far as abnormalities, so we did random biopsies, a series of 12 biopsies, and 2 of those came back positive for prostate cancer. Now, it wasn't an aggressive form of prostate cancer. It was a Gleason 6, and that's a scale that's used. It can be as low as 2 or as high as 10. Anything above 6 is considered aggressive cancer. Anything above 7 is high-grade cancer. And so that's what we were dealing with. Two positive biopsies out of a set of 12.
You know, I recall when you called, because the last thing you said to me was, I'll give you a call as soon as we know something for sure. And you called, and you said, how you doing? And I said, well, I'm just waiting for the hammer to drop. And you said, well, it's a velvet hammer, and it is cancer. And something happens up here.
Right.
And I'm sure the same is true with other men, but I just sort of snapped mentally because when I heard the word cancer, I heard what you said, but I did not listen to what you said. I came in for the appointment. You outlined what we could do. Surgery, radiation, let it go, because it was not aggressive.
Right.
And the choice was made to go with radiation. And in the last 3 years, my numbers have been down.
Down very nicely. Your PSA has been running in the 0.3, 0.4 range.
Which is a heck of a big improvement.
Right, it's right where you want it.
Doctor, I tell you what, we're going to take a short break because when we come back, I'm going to share with the folks at home the treatment that I went through. You'll have a chance to see the machine do its thing right after this.